It's so important that in South Yorkshire we deepen our long-standing collaborations with patients, with mental health issues, with people with learning disabilities and folk with autism. So there's a partnership with our communities and with our patients, but there's also a collaboration between different kinds of organisations, voluntary sector and statutory sector, local government and health. And today we're gathered to think about all of the new roles, new workforce roles that have been brought into being over the last few years, how they are being supported, understood, nurtured, developed and scaled up. So it's a really exciting day and a really tangible sense of integration and collaboration across South Yorkshire.
Physician Associates is a relatively new role in the UK, whereby we are taking graduates who've done a relevant degree in either biomedical sciences or psychology or speech and language therapy or something like that, and then training them in 2 years to become active leaders and clinicians in the workforce. In mental health, there's a lot of them working across the country now, really helping to support the teams, bringing particularly their physical health expertise into our mental health teams, which is really valuable. They're working alongside the whole team, but they're supervised by our doctors, our senior doctors, psychiatrists, who are ensuring that they're trained into the relevant activities needed by that team. They're a fantastic group of young people. They're brave, taking on a new profession, and I think they're going to change the world.
Part of the challenges of introducing a new role is whenever you're working in a big organization, you'll encounter resistance to culture changes, purely because that's the nature of a bigger place of working. So what we've had to tackle was, this is a new role. It'll be introduced to wards, and it's getting the wards and the services getting to know us and to trust us and to build those relationships. So we can have a real good symbiotic relationship between interacting with our service users and implementing those changes and supporting the services in those things that we hear directly from our stakeholders. One thing I would do differently in the roles when we were piloting them and introducing them is take each of the people who do my role across to the services, introduce them to the service managers, introduce them to the staff, introduce them to the service users one by one, purely because what we encountered was almost a sense of trepidation, because we're working directly with service users and the services implementing what we hear directly from them. There was a sense of they might be under inspection, but that wasn't the case. It was about working together so we could provide better care for our service users. It means we now have somebody who's directly and having a physical presence on our wards with our service users in those interactions, speaking to the relevant staff, speaking to the relevant stakeholders, and it gives the trust that key insight into what really matters to the people who we're working with directly. So we get to implement from the smallest of things to, I prefer to be told about my care plans or who my nurse in charge is, to much bigger things where they want more formal ways of providing feedback, and we co-produce those pieces of work with our stakeholders.
I've been in post for around 6 months, halfway through my training, which is a year's course. We deliver interventions around different psychological interventions, including behavioural activation, graded exposure, emotional regulation, sleep, problem solving, confidence building, and a little bit around medication support when needed. I think the biggest benefit of our role is that it's really goals focused, and it's really about working with the individual around what they want to achieve in their life and how their life can be different. So it's really recovery focused. The care plan that we do is based around strengths and identifying strengths, which really helps to drive forward the recovery approach. It's a new role, so there has been challenges along the way, because it's getting to learn about the role and for other staff members how our roles fit together. But I think it's really, really positive that hopefully the primary care mental health hub can bridge the gap between primary and secondary care. And I'm really looking forward to the challenge ahead and completing my course.
I think one of the big challenges with new roles is convincing some of the pre-existing workforce that they can be a help and not a hindrance. What I've found is that new roles generally, and physician associates specifically, have been incredibly enthusiastic in taking on new work, taking on responsibilities that perhaps, weren't sort of covered beforehand, and it's been really helpful for me as a clinician to be able to focus my time on other things and other aspects that I haven't been able to dedicate to, and overall, most importantly, helping provide really holistic clinical care.
So the benefits of seeing an advanced clinical practitioner is that the person with a learning disability can just see one person, one clinician, rather than seeing lots of different clinicians. And the work that I can do with them, we can do maybe in shorter appointments rather than someone having multiple appointments with multiple professions, and overall reducing health inequalities for people with a learning disability.
So I'm really proud to talk to you at the end of today's event about new roles. It's been a brilliant event. It's been overwhelmingly attended. People have come that hadn't even registered, which really shows the interest in learning together. We've had people from various different roles at various different levels in the organisation. We've had clinical leads and we've had managers, and this really shows the energy to do the best for our patients and to work in a different way. What we've seen today is how we are going to absolutely retain those traditional roles, but where we're going to integrate some of these new roles. And we've really enjoyed hearing from some of our patients, some of our carers, our volunteers, and also some trainees in new roles. Thank you ever so much for everybody that's come. It's great, and it's a really good foundation for us to work forward upon.
So there's a huge amount happening in South Yorkshire in new roles. And it's really, really important that we learn well together. We had a fabulous event last week, really connecting and really sharing about what some of the new roles are about, making sure that we are not duplicating. And we're really looking towards support from our academic colleagues, our universities, to take forward some research for us to help us to really, really make sure that we almost industrialise those things that are working really well. And of course, it's important to stop those things that aren't. So a really, really, really great work that's taking place in South Yorkshire. We're going from strength to strength, and it's great that we're submitting all of our work for a Health Service Journal Award. And of course, I hope we